Hello, my name is Kayla Hutton from Spring Arbor University. I'm going to be discussing increased patient satisfaction strategies for improvement. As nurses, we all think that we know what will help the patient scores increase, yet we see nothing being done about it. How are we expected to create a happy, safe environment for our patients with minimal staff resources and high patient loads? In this PowerPoint, I will discuss ways that patient satisfaction can become increased, not only in the facility I am employed at, but in facilities throughout the United States. I will address mission and vision statements, complete a SWOT analysis, identify my aim statement, and lastly, describe the structures and how I will engage staff during the process. Patient satisfaction scores have been the hot topic of discussion in recent years, with many hospitals focusing on the hospital consumer assessment of healthcare provider and system scores to receive profit. What exactly is patient satisfaction, though? Dingman, Williams, Fossbinder, and Warnick state patients have expectations of the care they should receive and that the patient satisfaction is the care the patient receives compared to their own perspective. While satisfaction scores are important, there are many pieces that come into play with how these scores are affected. From facility appearance to the way the food tastes, pain management, and nursing staff, patients are in control of the revenue their hospitals take in. Nagy and Fawcett claim a mission statement helps an organization state what they are going to do and why in a more concrete fashion than a vision statement. Based upon the issue of increased patient satisfaction, I feel an appropriate mission statement for my organization would read, "We strive to promote health and happiness within our community at every step of life." As an organization as a hospital, promoting health is number one, as the goal is to refrain people from entering the hospital environment. The happiness piece addresses patient satisfaction, as we are encouraging happiness outside of the organization and inside as well. Vision statements are what your organization believes are the ideal conditions for your community, or how things would look if the issue important to you were completely perfectly addressed. The vision statement that would fit the organization of which I work would read, "We will foster compassion, competence, and a healing environment to the communities of which we serve by providing exceptional health care." Again, while the patient satisfaction is vital to upholding the reputable status of an organization, the most important piece is to make our patients feel they are leaving with a clean bill of health. When patients feel that they have come into the hospital feeling ill, yet are leaving healthy and happy with answers, satisfaction scores should increase. Patients need to feel as if they are receiving compassionate and competent care from upper management all the way down to the housekeepers. Both the mission and vision statement are important pieces to an organization, as it holds the foundation of what the organization gears their care towards currently and in the future. How patients perceive and evaluate their care encompasses the entire patient experience toward healthcare providers and the environment of hospitals and other facilities. By proving to the patient that our main goal and focus is solely on them, as directed by the mission and vision statement, the goal should be that they quickly turn their frame of mind around into a positive experience. Utilizing the SWOT analysis in the workplace offers individuals to discover ways to solve problems, find opportunities promoting success, clarify directions and choices, decipher when and where change is appropriate, and allows a path change if necessary for the benefit of the organization. A SWOT analysis can help encourage employees to focus on the weaknesses and allow everyone to put their own input of how we can implement changes. Within the hospital that I work, there are many strengths that stand out to patient satisfaction. Nurses are to respond to patient call-outs within a 2-minute time frame, which induces a positive experience as patient needs are getting attention in a timely manner. Each patient is assigned a nurse and a nursing assistant to help them with their needs, along with collaboration of the healthcare teams. Teamwork is conducive to a positive patient experience, and that is a strong suit we have going for our organization when fully staffed. The staff works well together in answering call-outs and helping pass medications in a timely manner per patient request. When we encounter patient dissatisfaction, we are able to refer them to patient services, where a staff member will speak to the patient regarding the issue at hand and will offer the patient and/or staff ways we can improve our performance. This allows the patient to feel like they are being listened to. Unfortunately, there are many weaknesses that surround us in the hospital. The first and probably most important being staff availability. Far too often, the nurse-to-patient ratios are elevated because the turnover rate for staff is at an all-time high. I have recently noticed that all departments may either be short-staffed or flooded with orders, as completing scans such as x-rays can take a very long time, which is difficult for a patient to understand when they're unable to eat or drink pending the results. Staff satisfaction also hinges a lot on patient satisfaction, as patients are aware when the nurse or CNA are unsatisfied. One area that needs improvement is the communication between physician, nurses, and patients. A problem patients have encountered has been their admitting physician telling them early in the morning they are discharged, but not explaining the process that involves the discharge. The patients become upset with the nurses as they feel we are keeping them longer, when in actuality we just need time to get their paperwork around so they understand their instructions. As far as patient satisfaction goes, the nice thing about the hospital that I work at is that we were recently bought out by another large hospital, which provides a patient with amplitudes of opportunities as far as their care goes. They're able to seek specialists that were never an option before, and the communication from facility to facility is seamless. Another opportunities patients have expressed satisfaction with is that the hospital is now a level 2 trauma. Should unfortunate circumstances arise, patients are able to seek emergent medical attention and begin life-saving interventions right away, rather than waiting to be transferred. When patients are dissatisfied with care they have received, they always have the option to seek medical attention at other facilities, which is a major threat to an organization. Within the last 5 years, the walk-in clinic was removed from the area, which caused a rise of patients entering the emergency room and being admitted for ailments that could have been addressed on a walk-in basis. Since then, a new walk-in clinic has been built, but many people are not aware of it, causing an increased number of patients entering the ER, bogging the wait time down. An AIM statement sets a foundation of how you will accomplish your desired goal. The AIM statement must maintain very specific details and must also be measurable without extraneous background information. To improve patient satisfaction at my current place of employment, I feel an appropriate AIM statement focuses on the nurse-to-patient ratio, as well as interdisciplinary communication. Therefore, my AIM statement for my hospital reads, patient satisfaction scores will increase by 5% within a 6-month time frame after implementation of nurse-patient ratios at 1:4 on all medical surgical units, and after education has been provided to each discipline regarding communication. Nurse-to-patient ratios were not significantly impacted until the hospital dismissed the travel nurses that kept us afloat. Bringing travel nurses back into the picture will not solve all problems, as they are costly. However, if we are able to bring satisfaction scores up, the reimbursement received may be enough to compensate the use of them. While it's not clear how much compensation hospitals get for HCAHPS scores, we do know that the Patient Protection and Affordable Care Act uses value-based incentive payments that are based off of the scores. Seeing as patient satisfaction within the hospital begins with the staff, the key stakeholders would be all staff members, but mainly nurses. As stated before, one element within my current facility that affects patient satisfaction is lack of communication. Therefore, we would need all hands on deck with a quality improvement project. To help shed light on the situation that impact patient satisfaction scores, there certainly needs to be education that takes place to not only those involved with patient care, but everyone within the organization on the culture and perception of patient satisfaction. Changes will not happen overnight, so there needs to be multiple education sessions. Physicians need to be reminded that they and nurses work very closely together to help the patient get well. Yet when there is miscommunication, not only does it impact patient satisfaction, but it could put the patient at harm. The culture within the hospital is impacted significantly as we are hiring and paying nearly $30,000 for a new resident nurse for them to receive training and leave once her contract is up 1 year later. The reason these nurses are leaving is due to patient ratios they are being handed. Bringing in travel nurses would allow the ratios to be 1:4, allowing the nurse to spend more time with the patients. Once we have hired staff available and ready to work, we can slowly eliminate some of the travel nurses. The leadership skill that I plan on using is simply listening to the stakeholders that are involved. I understand that nurses are at the forefront of change, as they are the ones strictly dealing with patient care. So listening to suggestions of change they have is key. After suggestions have been made, as a team, we can come up with ways to implement small changes to make our patients satisfied with the care they are receiving. Patients all have a different perception of the care they wish to receive, and unfortunately, it's impossible to make everyone happy. However, as a hospital, it is our goal and duty to attempt to make each and every patient feel they have received competent care for their visit. As a frontline staff, we need to adjust our skill set to accommodate each patient differently for the needs they require, although it can be so difficult with many barriers in the way. By providing educational in-services monthly initially and annually thereafter, we can hope to continuously remind all disciplinary teams that communication is vital to patient satisfaction as well as safety. Secondly, bringing in travel nurses is a costly expense, yet we will see an increased revenue over time as the nurse-patient ratios are decreased, allowing the patient to feel they are connecting better with their nurse. The implementations are not something that we will see a change in overnight, but with time, patients will confidently choose a hospital that makes them feel secure and satisfied with their services versus one that does not. And these are my references. Thank you.